Prostate cancer in Uganda is among the top leading causes of death when it comes to cancer-related illnesses, and that's according to data from GlobalCan, and that is an arm of the United Nations that tracks cancer throughout the world. It stands at 5.2% amongst men in Uganda, especially above the age of 45, and amongst the 5.2%, 90 of them or over are not even aware that they are ill. What is causing the gap of information, and how best can we address this to make sure that we save our men from dying? A very good morning to you, and you are welcome. I am Viola Sassia. This is NTV Medical Matters, supported by Bill and Melinda Gates Foundation. Uncle Sam, thank you so much for your time. When and how did you first find out that you had prostate cancer?
I found out that I had prostate gland enlargement in 2019. During that time, we had a congregant in our church. She was a sister in Mlago Cancer Institute. And when we went, she took us straight to the lab technicians, and they tested blood. The results came, and really, I had cancer of the prostate, but in early stages.
So what were some of the signs and symptoms that then later pushed you to seek medical attention?
First and foremost, I began urinating at night more than 5 times, which was unusual. Secondly, there was one time I urinated blood, which was very, very, very bad. Thirdly, I got a back pain, which was very severe.
So, Uncle Sam, how did you feel when you first received this diagnosis that you had prostate cancer?
That put me to a standstill in my life. Because when you tell somebody about cancer, that is a death sentence. Many know that cancer kills. But as time went on and I was on treatment, I got courage because I was seeing the difference.
Speaking about going for testing, what were some of the tests or procedures that were carried out in order to confirm this diagnosis of prostate cancer?
The common one is blood test. That is a must. If you enter there, you begin with a blood test. Second, you go for biopsy. Third, you can go to MRI.
So had you heard of prostate cancer before? Were you aware of it? And if you did, what sort of information did you have about it?
I normally read newspapers, listen to radio, and watching TV. They talk about it very much. So through that, I also knew that there was prostate cancer.
Okay, so Uncle Sam, what were some of the treatment options were you given, and which one did you eventually go with?
The doctor, Mokoko Fred, chose for me that I was going to be given treatment, not an operation. So I went on treatment. I normally had an injection, and they were injecting it on the stomach. I was going there after 3 months injection, so I got 8 of them, and it really saved me.
Thank goodness you didn't have to go for the surgery, but then how did this treatment have an impact on your body as well as the state of your mind at the time you were receiving it?
There was no side effect. I was getting it, I was sleeping well, appetite was there, I was eating well if given food. Now I'm a survivor.
Which is very good news.
Good news.
So, Uncle Sam, with you having gone through this experience, what are some of the misconceptions, wrong information, and myths that you think are out there in the community that most men may believe?
That I thought it was an STI, which is wrong. Some think that a doggo, somebody bewitched me. He bewitched me, and I got this, which is wrong. Normally we keep quiet. because we think that being open is a shame, which is not. And men are dying. They are brought to the hospital when time has gone and the cancer has moved to the whole body. So it is better you go test early. If you reach the age of 45, go and test whether you have it or not. It is not hereditary that your grandfather had it, then you can have it also by gene. No, it can come anyhow.
And finally, what is that message that you have for men out there, as well as the community at large and the government?
First, that cancer can be healed when you go for screening early. Cancer is a disease for only men, no ladies. Prostate cancer. Cancer is treated in most cases. In Mulago, they have two sections. One is a paying section, and another one is a public, free of charge. So you can either go to paying section or to free of charge. They can all work on you. So I don't think men should think that if I tell people you will begin to be open, you'll be ashamed. No, it's a disease which can be cured, and it can infect anyone.
And to the government?
The government should put in more funds to the Cancer Institute so that treatment is there. Because in most cases, they write for you treatment, you have to buy it. They write to you prescribe, you buy it. But if medicine was there, let government put in more funds. That's my urge.
Thank you very much. It's really been a pleasure. Thank you for your time. Mr. Samuel Cheza, better known as Uncle Sam, telling us about his story of survival from prostate cancer. He has encouraged all men to be confident about going for early checkup, as well as sharing their stories and amplifying the voice so that we can stop prostate cancer amongst men. Once again, you're welcome. It's NTV Medical Matters, supported by Bill and Melinda Gates Foundation. I am Viola Kusasira, and we are happy to have you here. In studio with me is Dr. Noleb Mugisha, who is the founder of cancer prevention at the Uganda Cancer Institute of Uganda. It's really a pleasure to have you, Noleb.
Very glad to be here, Viola.
First and foremost, what is prostate cancer? What causes prostate cancer?
Yeah, Viola, that is a very, very important question. But I like beginning from, the beginning. Mm-hmm. In general, what is cancer? Oh. So, everyone needs to understand cancer is a disease that develops from within the body. It's not an infection that comes from outside, like malaria, like HIV, like COVID. But it's the cells in the body that change and develop into cancer cells. And that's important for everyone who is, watching us, who is listening to us, to understand. Now, cancers are named according to the cells that become cancerous.
Okay.
Now, I speak slowly so that people understand. So if it's prostate cancer, it starts in the prostate, and it's the prostate cells that become cancerous. And that's important for people to know. So prostate cancer is a cancer that starts in the prostate.
Okay.
And sometimes there are some parts of our bodies where cells can be where they are not supposed to be. We call them ectopic.
Okay.
So if for instance, breast cells are somewhere in the body and they become cancerous, that person will be suffering from breast cancer, even though the cancer is somewhere else in the body.
Interesting.
Yes. So let's come again now to your question. What is prostate cancer? Prostate cancer is the cancer that starts in the prostate. Now, I was told when I was studying English in P5 that when you say, what is a dangerous vein? And you say, dangerous vein is a vein which is dangerous. You haven't defined it. But I think it's important for people to know we stick to prostate because it's a cancer that starts in the prostate. But somebody will ask, where is the prostate? I had Uncle Sam telling us that prostate cancer is only a disease suffered by men.
Yes.
Because it's only men that have the prostate.
Yes, yes.
Just like you could say cancer of the uterus. Do men suffer from cancer of the uterus?
Yes.
Of course not.
Yes.
Men don't have a uterus. So because it's only men that have the prostate, it's only men that suffer from prostate cancer. And I hope the more I say this, then people get to understand. So the prostate is one of the organs of the reproductive system of a man. Now it's located just below the bladder, the urinary bladder. So usually when urine is flowing out of the bladder, the tube that brings urine that we call the urethra passes in the middle of the prostate.
Okay.
Yeah, so that's the part that, you know, develops prostate cancer. And because of where it's located, many of the symptoms of prostate cancer will manifest in urine. Because urine is what comes out of this person that passes through the organ where the prostate cancer develops.
Yes.
And I guess that would make sense to any man listening, and for that matter to any woman who
Yes.
bothers to understand.
To understand, yeah.
Yeah, but that is what prostate cancer is. And then, usually what I want to add at this point is to say that the prostate is the part of the man's reproductive system that actually produces semen.
Okay.
Semen, the Baganda call it amazigo gomusajja, or something like that. So because it's what produces semen, now usually when somebody's prostate is affected, then also their reproductive capacity is affected.
Okay.
Yeah, and as we go through, you know, this talk show, it will become more and more clear what prostate cancer is, why it's a cancer that is suffered from by only men, and why it's when men suffer from it, their reproductive ability is affected.
Thank you so much, Noleb.
Yes.
I just want to let our callers know that our phone lines are open and you can be able to call in with your questions, whatever is burning right now as we go through this talk. Call the doctor, ask him anything that's on your mind about cancer, as well as prostate cancer for this matter. So let's talk about the causes. The causes, what really causes that? I read somewhere about poor diet. Is that true?
Yes. Now, when we talk about causes of cancer in general, I want all our viewers to understand that cancer is not like infectious diseases where, you know, a germ gets into your body, like bacteria or a virus, and then you develop the disease. And when we're in Uganda, I like using malaria. A mosquito bites somebody, it injects in them malaria parasites, they suffer from malaria. Now, cancer is not like that. As I said at the beginning, cancer begins in the cells themselves. So what causes prostate cancer? What I'm trying to explain here is that there's no cause out there that you can stop and then stop prostate cancer.
Oh, yeah,
I hope that makes sense to our viewers, because many times we like assuming that all diseases are caused by bacteria, by a virus, by germs. And I want to assure you, our viewers, that it's not unusual for health workers also to make that error. That, you know, the prostate virus or the prostate bacteria. No. So what causes prostate cancer? Number one, when we're talking about cancer, we talk about risk factors. And what I want people to understand here is that when we talk about risk factors, it means there's no single one that leads to the disease.
Okay.
It's a number of them that come together to cause the person to eventually suffer from the disease. And so we come back now to what causes prostate cancer. So here we talk about the risk factors for prostate cancer. So risk factor number one is being a man.
Okay.
Yeah, because when you're a man, you have a prostate. And so your prostate can easily develop prostate cancer.
Yeah.
So risk factor number one is being a man. Risk factor number two is age. Now, this is also important for our viewers, that in general, the risk for suffering from cancer increases with age. generally speaking. But I want our viewers also to know that there are cancers that are common in children. And this is important. That is the irony that many people, get confused with. There are many people there, probably even who are watching us now, who think that children don't suffer from cancer. But unfortunately, children also suffer from cancer. And there are actually specific cancers that are only suffered from by children. One of the very, very good example is retinoblastoma, a cancer that develops on the retina in the eye. That cancer, we don't see it in children who are above 10 years. As a matter of fact, it's commonest in children who are below 5 years. So we come back now to prostate cancer. Prostate cancer, the risk of suffering from prostate cancer increases with age. If you were watching us from the beginning, you had Uncle Sam saying that when men reach the age of 45, they should have themselves checked for prostate cancer, because we don't see prostate cancer below the age of 45. As a matter of fact, I have not met a man below the age of 50 suffering from prostate cancer. I have not met. I'm not saying there are no men who have suffered from prostate cancer who are below 50, but I have not met anyone. But I can tell you, I can put my money that there's no man below 30 who has suffered from prostate cancer.
It's nice that you clear that it was the burning question for me.
Yes.
I'm sure there are questions in the audience, but for myself, I was wondering, can a man get very ill at a young age like that? But since it's not there and you've cleared it, let's look at...
I have met a teenager suffering from a cancer in the prostate, but actually this cancer was a different type of cancer. Because in the prostate, also there are other cells.
I know.
Yeah, I mean,
wild.
It can sound a bit unusual for somebody who may not appreciate sort of the biology, but in different organs in our bodies, there are different cells. So in the breast, there are fat cells, there are lymphatic cells, there are blood vessels that have blood vessel cells. So somebody can develop cancer in the breast that is not breast cancer.
Okay, that's really interesting, but we could have a whole day talk about all these details. Let's talk about...
what causes prostate cancer? I said being a man. I talked about age. These are risk factors.
I just want to know the early onset signs that a man 45 and above should look at. Yeah, so what are the earliest signs of prostate cancer? Yes. Now I want to say this again, that prostate cancer in the early stages will have no signs and symptoms. Oh my God. And this is why many people will come late. But the signs of prostate cancer in general, number one is seeing blood in urine. Now I know what is common out there is difficulty in passing urine, which is a sign of an enlarged prostate usually. But usually that's not likely to be a sign of prostate cancer. But seeing blood in your urine, my brothers, especially my senior brothers out there, that could be the first sign of prostate cancer. Seeing blood in semen. I have met a man who said, every time I have sex and I ejaculate, I see blood. And that time it was infection, but I think like 3 years down the road, we made a diagnosis of prostate cancer. And the man is free of prostate cancer now as we speak. We treated him, it was early enough, and he's free of prostate cancer as we speak. So blood in urine, blood in semen, but also the signs of difficulty in passing urine can actually be signs. I'll stop you there. We have a call. Let's first pick that one up and then we shall continue with our point. NTV Medical Matters, hello. Your name and where you're calling from?
I'm calling from Michigan.
Your name and your question?
My name is Jason Bosa.
What's your question?
Is prostate cancer treatable?
All right, thank you for your question.
Okay.
I don't think I had the question.
Is prostate cancer treatable?
Yes. So that is a very excellent question. Prostate cancer is treatable at any stage.
Oh,
That's
amazing.
important.
Yeah.
When it's early, it actually can be treated and cured. And I'm using the word cured so that people can appreciate that actually cancer can be treated.
Yes.
Somebody can live free of cancer.
When you bring that up, you had a question earlier before the caller came in, and
Yes.
this question is about if there are no signs almost, how are men then supposed to know? So do you get to go for a diagnosis every year? How do you get to know if you're really feeling normal?
That's a very good one. Remember what Uncle Sam said? He first thought he had a UTI, an STI, a sexually transmitted infection. So many men will present with symptoms, either difficult passing urine or urine burning as it comes out, and they will first think, you know, this is an infection. But we recommend that all men starting at the age of 45 should go for screening for prostate cancer, because that's the only thing that is going to give us a chance to arrest this prostate cancer before it becomes advanced. So I said prostate cancer early will have no signs and symptoms, and you asked how are men then going to have it diagnosed early. The principle is go for screening. And men, you can go for screening every 3 years, starting at the age of 45.
Let's pick up a caller.
Yes.
Quickly. NTV Medical Matters. Hello. Sorry about that. So we're going to first take a commercial break, Doctor. When we return, we shall be talking more about how you can get to know, even though you're feeling normal and you're walking around just normally, but you're going to die the next day, prostate cancer.
Yes.
So thank you so much for staying with us. We are taking a commercial break. When we return, NTV Medical Matters continues, and we are discussing prostate cancer. Prepare your calls, prepare your questions, I beg your pardon, because our phone lines are open and we'd like to hear from you. Welcome back from the break. It's really a pleasure having you this morning. I am Viola Sasya. You're watching NTV Medical Matters, and we are talking about prostate cancer, the causes, and it's also among the leading causes of death in Uganda. So why is that? And why should we know about more information? And how can we prevent these deaths? So our phone lines are open. Feel free to call in and also go to social media and have this conversation. Let's educate each other. So we have a doctor here, Dr. Nole Mujisha, who is the founder of cancer prevention at the Uganda Cancer Institute. We are having this conversation, and we broke off speaking about why do people be sick but no signs. So let's start with that.
So I had mentioned, Viola, at the beginning that cancer generally begins in the body, and diseases where something comes from outside the body are the ones that are likely to have symptoms early, like malaria. When a parasite comes in the body, somebody gets fever, you know, the body is responding to fight what has come into the body. But because cancer begins within the cells themselves, it's just like a government having a rebel coming up inside the government. They will not know that there is a problem. But if the attack comes from outside the country, then they will know and respond. So now, that's the reason why we need to go for cancer screening when we are well. We don't want to wait until when we are unwell. For many cancers, including prostate cancer, if men wait, they are likely to come when the cancer is advanced or is late. And that should follow up, maybe, in my opinion, with how do we then detect that cancer is there? Prostate cancer is there if the man is feeling. Let's say a 45-year-old man has come for prostate cancer screening. Usually we take the history, we ask them their lifestyle, what they eat, and I should tell you that we know that high-fat diet, you know, this is meat, the pork that we talk about, you know, goat's meat, cow's meat, you know, that increases the risk for prostate cancer. So we recommend diet that is full in fruits and vegetables.
I'll pause you there. We have a caller.
Yes.
NTV Medical Matters. What's your name and your question?
I'm called Mwanga Moses Kitio.
Okay.
Does masturbation cause cancer of the prostate?
Thank you for your question.
The answer is no. Masturbation does not cause cancer of the prostate, neither does it reduce the risk. I hope you've heard that. Yes.
That's interesting, yeah.
Yeah. And I think there is another myth out there that frequent sex reduces the risk for prostate cancer? And the answer is no. There is no evidence that frequent sex reduces the risk for prostate cancer. Okay. I think I should say it at this point.
It's really nice to clear some of these myths, you know, the beliefs.
Yes. So I was talking about how do we screen for prostate cancer. So we first screen.
We have another caller.
Okay, that's fine.
We have another caller. Yeah. Hello there, NTV Medical Matters. What's your question and your name?
Yes, my name is Frank Kwehayo.
Okay.
I'm calling from Kasese.
Your question?
My question is, I have prostate but not cancerous.
Okay.
Can it be cured because I have moved to 50, close to 60, 1% or something, but 60, close to 60. So can it be reversed? And where does that doctor work, such that I go to his hospital?
What is the problem with the prostate if it's not cancerous?
It is enlarging.
Okay.
It is enlarged up 60 now.
All right.
But it's not cancerous.
Okay, thank you so much for the question.
So that's a very good question. So what he's talking about, the prostate is enlarged and is at 60. Mm-hmm. So usually the normal prostate should be on average 25 mils or 25 cubic millimeters, cubic centimeters, or 25 cc. So we usually want it to be up to 35. So when it goes to 60, we say maybe it has doubled. Now he's likely to have signs of urine obstruction in the flow, or can have frequent urinary tract infections, cystitis, infection in the bladder, but that is not cancer, and that can be treated. But that is not treated in Uganda Cancer Institute, where we treat prostate cancer. That's treated by the urologists.
Okay.
Now, the Mulago Hospital has a urology department, which is, you know, a department under surgery where there are surgeons who are specialists in problems of the urinary tract, the bladder, the prostate, you know. So you can actually attend these services and have care there, and you'll be well, and they will know how to monitor you for any signs of prostate cancer, you know, moving forward. So the comforting thing is that it's treatable and it's not cancer. But if you're 6, depending on your age, you need to have frequent screening for prostate cancer, because an enlarged prostate doesn't mean cancer, but it means that you are in the age that is high risk for prostate cancer.
Okay.
Yeah, I hope that
we
is
have
helpful.
another caller.
Yes.
We have another caller. Let's speak to that one first. We shall take more 3 questions and then we shall have the doctor answer them. So, NTV Medical Matters, what's your question? What's your name? NTV Medical Matters. Your question and your name, please.
Yes, I'm calling by name Fernal Patak.
What's your question?
My question is, my question is like,
I can't hear you, please speak up. Okay, so we have another caller. NTV Medical Matters, hello, what's your name and your question?
My question is,
yes,
I'm being up with John in Metiana.
Okay.
My question is, I diagnosed you with prostate cancer stage 3B. Is it curable? Because now they normally tell me that I should be coming every 6 months. Could I say I'm cancer-free now?
Oh, okay, thank you for your question. Let's have another caller. NTV Medical Matters, your name and your question, please. Let's have the answer to this question.
So my friend from Mitiana says she was diagnosed with prostate cancer, I think was treated, and now is advised to go every 6 months. I hope I got your question right.
Yes.
So whenever we treat cancer, we are looking forward to curing the cancer, depending on the stage. So if you're told to be visiting the cancer treatment center every 6 months, it means you're in what we call clinical remission. There are no signs of cancer, that is progressing in your body, but we keep monitoring you for at least 5 years. And when we have no signs of cancer after 5 years, we declare you cured.
Okay.
But even after that, we continue following you up so that in case another cancer comes back or the same cancer comes back, in case another cancer develops or the same cancer comes back, we are able to treat it in time.
Okay.
Yes.
I think it's really good that you monitor even after treatment. We were speaking about early diagnosis,
Yes.
but also please continue that answer with what are some of the exams that are done once a man goes to the hospital?
So when we've taken your history, we know your lifestyle, we know your family history, because one of the risk factors for prostate cancer is having a family history of prostate cancer. In one of your parents, in your father or in your siblings, then we know that you are at a higher risk.
Okay.
So we take that history and we are able to say you are at a high risk, moderate risk, or low risk. Then after that, we do what we call prostate specific antigen, PSA, which is a test we do on blood.
Okay.
Then we do ultrasound scan to know the size of the prostate. One of our friends called and said his prostate is now at 60. So we know that by doing an ultrasound scan.
Okay.
What we call NTV in Uganda, to know the size of the prostate. Also, when we do ultrasound scan, we know that the prostate has swellings inside it. Because the prostate is like a tomato, just imagine, and it should be smooth with nothing inside. But usually when cancer develops, small swellings begin developing inside the prostate that we call nodules.
Okay.
So when we do a scan, an ultrasound scan, we're trying to see are there nodular swellings in the prostate, which will then increase our suspicion that this prostate is likely to be developing cancer. So we do the blood test, PSA, which is prostate specific antigen. We do ultrasound scan to know the size and the consistency of the prostate inside. We can do what we call a digital rectal exam. You know, a doctor wears gloves and puts their finger through the anus in order to feel how the prostate feels. When the prostate develops cancer, the feeling when you press on it using your finger is different from when it doesn't have cancer. Then we can go ahead and do what we call MRI. MRI is an imaging technique that we use to assess the prostate in more detail as opposed to ultrasound scan. The ultrasound scan does not show us as much detail as the magnetic resonance imaging, which is called MRI. And all these tests can be done in Uganda. No one needs to go out of the country to be checked for prostate cancer.
We're going to talk about treatment shortly, doctor, but
Yes.
what advice can you give at this stage to men out there who feel stigmatized by what you've just defined?
Now, stigma is something that is really not something you can touch, you know?
Yeah, true.
And I want to appeal to my brothers, my senior brothers out there who feel, they feel showing up for cancer screening will make the community look at them negatively. And Uncle Sam was saying that cancer is a disease that anyone can suffer from. Now, when you say, what can I say to men who are feeling stigmatized? I can tell them they should feel encouraged. When they come, first of all, they find fellow men.
Yes.
And there are many men, like Uncle Sam, who have survived cancer, and they tell you that they first came when they had symptoms. Yes. But even then, it was still early for them. But we encourage you to come before you have symptoms so that chances of catching it at the early stage are very, very high. Now, what I tell these men is to know that there are many men we have treated and cured prostate cancer just because they came when the cancer had just started. And that should encourage you to go beyond stigma because you're trying to save yourself from something that may be worse in case you delay to come. Yeah.
Okay, that's really good. To the men out there, our viewers, please let's go for early cancer screening so that we just save you from dying. That is the worst case scenario.
Maybe Viola, I should say. Also to the women out there, encourage your husbands, encourage your fathers, encourage your friends to come for
So our role is to encourage.
Yes,
all right,
encourage
so
and support them.
We shall do that.
Yes.
So a man walks into the hospital, he's diagnosed with prostate cancer.
Yes.
What are the available treatments? Uncle Sam said something about an injection in the stomach as mortified. What are some of the other treatments?
Yeah, very right. When you said it became mortifying. Mortifying is a big word.
It's a huge word.
So one of the treatments, so let me first narrate to you the prostate cancer treatments that are available. One of them is hormonal therapy, where we inject a drug that is actually a hormone blocker on the abdomen.
Oh my God. That's
so we inject it on the abdomen because that's the best site where we can inject it subcutaneous. We are able to pinch off, you know, the skin and inject not in the abdomen, but under the skin. That's where it's given. We could inject it anywhere else, but the skin is the safest.
Okay.
And the risk of injecting it in the muscle, the risk of injecting it in the blood vessel is much less on the skin.
Okay.
Now that drug is actually a wonder drug in controlling the prostate cancer and arresting it so that the other additional treatments can be given.
Okay.
Yeah, and when Uncle Sam says that it can be scary, but I can tell you many men who have come for it just 2 times. They will tell you, they just gave me my injection. It takes like less than 2 minutes and it's done. And the man goes back to do their work, you know? So that's hormonal therapy. Another therapy that we give, another mode of treatment is radiotherapy, where we give high energy radiation through the prostate area in order to destroy prostate cancer cells. And men should appreciate this, that when we give radiotherapy, it's not surgery, it's not an injection, it's the way you take a photo, you know, with a camera. So this light, this radiation goes through that body part in order to destroy the cancer cells.
Okay.
Another mode of treatment is surgery, where the prostate that has prostate cancer is removed surgically. Another mode of treatment is chemotherapy, where we inject cancer drugs through the blood vessel in order to saturate in the blood and go and destroy the prostate cancer cells. Now, for many men, we can give a combination of these treatments so that, and the aim is to really maximize the impact on the cancer in order to benefit this man that we are treating. Now, I want to say this, that whenever we begin treating prostate cancer when it's early, chances of curing it are high. And as far as treatment, availability of treatment in Uganda, at the Uganda Cancer Institute where I work, we have all these modalities of treatment. And I want to tell you that in the modality for radiotherapy, we now have a linear accelerator which actually delivers the dose of radiotherapy, exact dose,
where
in
it
the
hurts.
exact area where the cancer is, and now we give men what we call radical radiotherapy.
Let's talk to a caller first before we come back to that.
All right.
NTV Medical Matters, are you there? What's your name and what's your question?
Yes, I'm Lawrence from Ugolobi. I would like to ask the doctor something small.
Could you please speak up? We cannot hear you.
Yes, I am asking a question like.
Please go ahead.
I would like to ask, which other infection or disease can cause low sex performance on a man?
All right. Thank you.
That's a good question.
We have another caller before we go to that. We have another caller, NTV Medical Matters. What's your name and what's your question?
My name is Emily. I'm asking if there is any other hospital other than Murago where cancer screening takes place. They are relying so much, so many people there. Thank you.
Thank you, Emily, for that question.
Thank you very much. A gentleman asked, are there other infections, that can cause low performance in a man? And the answer is yes. Any infection that affects the pelvic area or below the abdomen, where the prostate is, where the nervous system that the nervous system for the man's reproductive system is, can affect a man's performance. And what I mean by performance, I think he meant a man's sexual performance. So when one has prostate cancer, because I said the prostate is the organ that secretes the semen, that can reduce the performance for a man. But even if you have infection in the prostate, it can reduce the performance. Even if you have infection in the bladder, it can reduce the performance. So if any man has reduced performance, it doesn't mean they have prostate cancer. It might mean they have an infection in that area. And their responsibility, I recommend they should go for a medical checkup so that they are told why that is what they are going through.
Okay.
And then Emilia asked, are there any other hospitals that can do prostate cancer screening other than Mulago? The answer is yes. It's yes because these tests that I talked about actually can be done in different hospitals. The only scenario that we have, many Ugandans will want to come to Uganda Cancer Institute for anything, cancer related. But if you find any hospital, regional referral, even private hospitals that have qualified doctors, they can actually do some of these screening tests. They can interpret them. And if they suspect there is cancer, then they can send you to us.
Okay.
The only thing I want to emphasize is that prostate cancer treatment is treated in a cancer treatment center.
Okay, so I like that you emphasize that. Let's speak to a caller first.
Yes.
NTV Medical Matters. What's your name? What's your question?
My question is, can the doctor tell us the symptoms that can the doctor tell us the symptoms that most likely show that you have cancer, prostate cancer?
All right, thank you. Let's continue. He wants to know about symptoms, but I think we spoke about that, but he's just joining us, I believe.
Yeah. So I was telling you that cancer treatment, we recommend, not that we recommend, actually cancer treatment is a multidisciplinary, service. That it needs a surgeon, needs an oncologist, needs a counselor, needs a pain specialist, and this is best provided in a cancer treatment hospital.
Yes, yes.
Yeah? And in Uganda, cancer treatment, Uganda Cancer Institute is the only government cancer hospital. And so if anyone has cancer out there, really Uganda Cancer Institute is a place to receive treatment. And Uganda Cancer Institute has branches. We have a regional cancer center at Imbarara Regional Referral Hospital. We now have a regional cancer center in Gulu City, the Northern Uganda Regional Cancer Center.
Okay.
We have a community cancer center in Mayuge at Chigandaro Health Center. And we have a site to build a regional cancer center for Eastern Uganda in Imbali. What I'm trying to say is that we are trying to decentralize cancer treatment so that it's accessible geographically to many Ugandans.
Okay.
Yes. But for cancer screening, for prostate cancer screening, you can go in any regional referral hospital or any big hospital and say, I want to check for prostate cancer. You'll be able to be provided the service.
I think we actually have another caller before we go back to the signs and symptoms real quickly. We had gone through them, but I think our viewer is just joining. So let's speak to someone else, NTV Medical Matters. Your name and your question, please.
Good morning. This is Emmanuel. And I would like to thank the doctor and you, the host, for this program. But I wanted to ask, how accessible is the service for screening the cancer and treatment in Mulago? Many have suffered, or even Ugandans are suffering because of a lack of clear procedures of how we can access those services. And then too, maybe the doctor will also provide his personal contact if he doesn't mind for sometimes some inquiries. But he could also tell us some other medical centers or places around the city where a person can access good screening. Thank you.
All right, thank you so much, Emmanuel. the doctor. I hope you noted that.
Yes.
Our viewers, I just want to remind you that the numbers to call are on our screen. Just call in and ask your questions to the doctor here about prostate cancer, what we are discussing this morning. We also have someone else on the line, NTV Medical Matters. What's your name and what's your question?
Thanks for the program. Only have that in the future going forward, it would be appropriate if probably provide an SMS rather than us interrupting the doctor when he's making responses. Because when he's just beginning to respond, then somebody is calling, then you interrupt him. Then preferably also to expound on the issues, because when you go in all the washrooms around the country, you'll find multiple sex versus cancer, and then masturbation versus cancer, and then somebody fails to know exactly what to do. But my prayer would be an SMS as opposed to calls, because those interrupt the flow of the doctor's comment. Thanks so much.
All right, thank you. Thank you so much. So you can go ahead.
Yeah, thank you. I think let me talk about the symptoms of prostate cancer that the gentleman asked. He might have come late, but it's important. I said blood in urine, blood in semen, difficulty in passing urine, reduced urine stream. What I mean here is that a young man will urinate far from themselves, but a man whose prostate is enlarged, they are likely to, urine is likely to flow as if something is stopping it from flowing. That can be a sign of prostate cancer, but I said usually that's a sign of an enlarged prostate. And some men will develop prostate cancer and the prostate will not be enlarged at all. So these symptoms may be not there, but the cancer may be developing. And I also said that early prostate cancer will have no signs. So I am recommending we don't wait for signs. We present ourselves for cancer checkup, so that we are able to identify it before. And if you have any difficulty in passing urine, it's burning, it's painful, some men will go to urinate and the urine will first refuse to come. We call that hesitancy. Or they will want to urinate and the urine will flow out before they reach the urinal. We call that urgency. All those can be signs of prostate cancer, but they can also be signs of an infection. So thank you very much. How accessible are cancer screening services in Mulago? We have a cancer screening clinic Monday to Friday at the Uganda Cancer Institute, and the services are free. So that's how accessible it is. But we have many people who come for these services. So when you come, you have to be ready to sit and wait, because I mean, that's what it is. But as Uncle Sam said, we also have now private services there. So some patients will come and they want to go and pay money and they don't have to wait for a long time. And then somebody said, I think somebody asked for my phone number. I think I'll give it at the end, not now. Yeah, thank you very much.
We're actually running out of time, so any last remarks in just about a minute?
Okay. So my last remarks, all men starting at the age of 45, kindly go for prostate cancer check screening. It's important, that's the only way we are going to detect the prostate cancer early, treat it and cure it. Okay. Yes. And somebody asked for my number. Maybe I give you a phone number for Cancer Institute. That's sure deal. Okay. You know. Go ahead. 0414 540 0414 540 040. And then my phone number is 0785 55 3368.
Thank you very much, Dr. Mugisha. It's been really good having you here. We can't exhaust this conversation because clearly we don't have enough time, but we hope to have you again. It's really been good. Thank you, our viewers, for really committing to watching this show about prostate cancer. The next week we shall have a different episode, but we shall make sure we follow up prostate cancer so that we save our men in our communities. I am Viola Sasha. It's been NTV Medical Matters, supported by Bill and Melinda Gates Foundation. Have a lovely day.